Hello, my name is John Takiff, and if you're watching this video, it's probably the case that you or someone you know is suffering from pelvic pain, or CPPS as it's also called. In this video, I'm going to be talking about my own struggles with pelvic pain and how for the first 4 years of dealing with this problem, I approached it in the way I think many people do, which is I went to multiple doctors, I saw 2 different physical therapists, I bought a bunch of books on the subject. I was stretching intensely twice a day, meditating 30, sometimes 45 minutes a day. But no matter what I tried to do, no matter how much time I spent or money I spent, I was not able to make real reductions in the symptoms that I was dealing with. I was on sort of a cycle of ups and downs. I didn't really seem to be getting much better. And no matter what I tried, I wasn't able to really bring my pain down in a noticeable way. And so it was a very, very kind of dark, difficult time. It was hard to socialize. A lot of times people wouldn't believe that my symptoms were as bad as they were. A lot of times I'd have to act my way through situations just out in the world when I was in just tons of pain, but I had to just deal with life. So it was very difficult in those first 4 years. And about the beginning of year 5, I made a change in how I was approaching this problem. And that's what I'm going to be talking about in this video today. When I changed the way I was approaching the problem, I started to be able to get some small but meaningful reductions in pain and tension. And over time, those reductions in pain and tension started to add up. And so about 6 months into dealing with this problem in a new way, I had brought the pain down to a level where it was still a problem, but I was sort of out of this cycle of pelvic pain where it was just sort of seemed like random ups and downs. And no matter what I threw at the problem, I couldn't really reduce it. 6 months into dealing with this in a new way, I was sort of out of this cycle of pain. I had noticeably less pain and tension. But it was still a problem. It was still difficult, but it was no longer like the center of my life anymore. I had sort of brought the pain down to a point where it wasn't taking over my life all the time. And so I just kept working at the problem in the same way, which I'm going to talk about. And within a year, I had the problem to the background of my life. And now, about 3 years later, I suffer minimal symptoms, just slight irritation sometimes. It's just not something I really need to think about much. I'm just out of pain. And over the last 3 years, I've since become a high school teacher. I've gotten married, and this problem is just in the past now. I mean, occasionally I'll have some minor little symptoms, but as far as it affecting my life and my choices and employment and relationships, it just doesn't anymore. And I'm very, very thankful that I was able to get to this point. And so in this video, I'm going to be talking about how I was able to do that, and how I was able to get this problem to just fade to the background and no longer take up such a large part of my life. It took me a long time to figure out how to start to make real reductions in my pain and in my symptoms, because all the stretching and the poking around and the meditating, they weren't helping. So what I started to figure out at the end of year 4 was that it was my brain's response to the pain that needed fixing. Once I started to learn how to fix my brain's response to pelvic pain, I was able to create a healing environment in my brain and body that allowed for small reductions in pain and tension. And over time, in and of themselves, they didn't add to a whole lot, but over time, it started to accumulate, and my pain and tension started to noticeably go down. And so 6 months of dealing with my brain's response to the problem, rather than trying to stretch my way out of it, poke my way out of it, I was able to noticeably bring down the tension and the pain. And so like I say, about a year into dealing with the problem with this approach, it was just in the background. It took about a year. The way I started to do this was I revisited the idea of meditation. This was about the beginning of year 5. I tried meditating maybe a year prior as part of just advice or various protocols on how people, approach trying to reduce pelvic pain symptoms. So I was meditating what you might call mindfulness, a mindful way, like mindfulness meditation, where the goal was to kind of stop all efforting or stop your brain from kind of doing much, slow your brain down, and achieve a state of relaxation where you're not even trying to relax. You're just in this sort of state of less activity in your brain and everything's slower, and you're not trying to do anything. So the way that I would try to achieve this is I would do things like notice my breath as it came in through my nose and into my lungs, and follow the breath down into my body and follow the breath out, and attempt to stop doing any kind of efforting. And the goal of this was to try to get me to a relaxed state that would help me to reduce the terrible pain and tension that I was just struggling with every day. The only problem with doing this was it just didn't work for me. I tried it for 6 months. I was probably meditating half an hour a day. Sometimes I would meditate twice, but every day I would try to do it. And I would just feel like it would have been better if I had gone for a walk or found some other activity with which to distract myself, because I just couldn't get to this kind of Zen state that I was supposed to get to. Like, my brain was not going to slow down that much. It just doing these activities, following the breath, I would also align my breathing and synchronize it with my pulse. So I'd be taking my pulse and I would breathe in for 4 pulse beats and out for 4 pulse beats. All of, the goal of which was to try to get to this sort of relaxed state. But it never worked for me. So when I revisited this whole idea of meditation, a year later, I did it and started to approach it in a completely different way. What I started to do was I decided that I was going to just think about the space of the pelvic floor and observe the space of the pelvic floor as if I were a tourist or as if I were a neutral observer. And so I would start meditating by first just getting comfortable and breathing for a minute like you would, any kind of meditation. And then I would, just using my mind, visualize or locate the most awkward and disturbing, annoying, irritating pain point that I could find. And I would just attempt to place it using, just with a visualization, identify and locate that point. As far back, the worst possible pain point that I could find, I would locate it, and I would start to ask myself, well, what's behind this? Is there anything behind this point that I could notice? Can I relax this point? What's behind this point? And then I would keep kind of going back and further back, always trying to keep in mind that I was looking at this visually as a neutral observer or as a tourist to the area. So what I was doing while I was meditating in this fashion was I was keeping my brain busy. Rather than try to have it do nothing, which was impossible, I gave it this activity of constant exploration of this part of my body. You might call this meditating in this way, using a visualization or visualizing a certain part of your body. I also think of it as a remapping activity. And the reason I say that is because I don't think the brain has a very good sense of the space of the pelvic floor. And I'm going to get more into that later. As I was doing this exploration of the pelvic floor as a neutral observer, as a tourist, anytime I would notice an emotional interruption or any kind of emotional response, this could be a fear of when am I going to be able to get over this? Or what if I can never get over this? Or how is this going to affect my relationships? or my friendships or my employment. Or it could be something like, I hope that I can beat this problem in 6 months because then, my life will go in a different direction. Any kind of emotional response that I would notice as I was doing this exploration of the pelvic floor, what I would do is tell myself that this is mechanical trash. It's a faulty mechanical signal that my brain is putting out. So the goal was to minimize the amount of these faulty mechanical signals, these dysregulated emotional responses to this pain, which we're going to get into why this happens. But so this is how I practiced meditating over time, and this is how I took this 6 months a year, was able to bring the pain down. So as I kept practicing meditating in this way, a few things started to happen. First of all, I would notice that I began to be able to access more and more of the space of the pelvic floor. Like when I started, I would be able to access a pain point that was pretty far back. But as I got better at this, I began to access further and further back into the pelvic floor. And I think that's because I was helping my brain become more familiar with the space of the pelvic floor, rather than looking at it as this mysterious place that is the source of all these problems. Instead, I was helping my brain just treat it as another body part. I was helping my brain become more comfortable with the space. And I was trying to teach my brain to minimize these emotional responses, trying to undo this emotional dysregulation that's so common with pelvic pain. So a second thing happened as I kept working with this way of meditating. The emotional interruptions themselves, like these thoughts of, when am I going to be able to, how am I going to get over this? Why can't I figure this out? When is this going to be over? All these things start to become less and less as I started to condition my brain to just try to focus on this visual exploration. The emotional, and it was sometimes quite subtle, these little fears or hopes or emotional responses that we have to pelvic pain, sometimes they're fairly subtle, but I started to get really good at minimizing them by just treating them as faulty signaling or mechanical trash. And so what would happen is, as I began to get better and better at this, within these 15-minute meditations, which is how long I would do them for, I would start to get these small reductions in pain and tension. It would be like a little pop, or it would just be a little release. And at first, I wasn't sure that it was going to add up to much, because by itself, it wasn't a whole lot. But I was out of options at that point as far as conservative treatments. I mean, short of like, kind of radical surgery that some people do. I had done everything I thought I could do. All kinds of exercising, stretching, meditating, books. I was just sort of out of options. This was the only thing that was kind of giving me something. So I wasn't sure at first, but it just kept adding up. Like these small little reductions that I would get began to add up. And so again, about 6 months in, I really started to realize that I'm not on this pain wheel, and I'm out of this pain cycle. I'm underneath it now, and pain's just going down and going less. So with each of these little releases, these little pops, it would be like I would open a new door. I would open another little space. I started to become familiar with the patterns in the space of the pelvic floor, and I would start to be able to like draw lines behind points and access new areas in that part of my body that I had no idea, I wasn't familiar with. It was just this space that I started to get really good at recognizing. My brain became very familiar with it. I got better at minimizing these emotional reactions, these emotional interruptions. And this is how I created this space where, this window, I guess you would say, where I would get these little releases that added up over time. As I got really good at it, I started to be able to sort of use this out in the world. Like if I'm on the bus or something and I had like a flare, rather than go into, whatever the reaction is, just the fear and the kind of the just the stuff your brain spits out when you get these flares. I would go right into this visual sort of reaction where I would just locate the point that was bugging me, go behind the point, and just kind of use these principles in the world. And it was like a much better reaction than the emotional reaction, which just keeps you in this heightened danger state. So it took some conditioning and some teaching my brain how to do this. But this is how I was able to create this healing environment that ultimately got me out of pain. Another thing I started to figure out was that this visual exploration of the pelvic floor provides a really useful distraction from the emotional dysregulation that's so common in pelvic pain. By giving your brain something to do, by giving it this constant activity, this constant exploration, you create this very useful distraction from just the pain itself, the emotional reactions to the pain. And so this became like my practice, my meditation practice. It would be all about, I'm going to boil this down to 15 very focused minutes. Because for me, sort of beyond that, it was like it would drift, it wouldn't be as effective. But I got good enough at it where for 15 minutes, I started to be able to kind of really get in a zone with it and really minimize the kind of emotional garbage that my brain was spitting out. Just by using this visual exploration as a distraction for my brain. It was just totally different than trying to slow everything down and not do anything. Because, in pelvic pain, your brain becomes accustomed to these emotional responses. And so this was like the work that I needed to do to condition my brain to stop doing that, and it wasn't easy. It takes sensitivity. It doesn't always work. It takes some practice. But again, when I started doing this, I was out of options as far as conservative treatment. And this was the only thing that seemed to be getting me anywhere. So it was just a matter of small wins built up over time. And, 3 years later, I'll do the meditations for myself if I feel anything. So it's just sort of an occasional maintenance, but that's as much as it is. I mean, I just rarely think about this problem anymore. So I came up with a name for this type of meditation, which is, I call it active meditation. Other people use that term to mean different things, but to me, it just means the active part is I'm giving my brain this activity, something to do, which not only helps make the brain more comfortable with the space of the pelvic floor, but also serves as this very useful distraction from the emotional dysregulation that's so common in pelvic pain. But I want to talk about this emotional dysregulation right now. What is it about pelvic pain that causes it to filter into everything in our lives, and for it to always be something that is just so difficult, emotionally and mentally? It's just so difficult for our brains to deal with. First thing I'll say is, let's think about where the pelvic floor is in the body. It's located in close proximity to some critical systems. It's right near the base of the spine, right next to the gut, right next to the waste management system, right next to the reproductive system. And so the brain does a poor job of handling stimulus, an injury in that area. And so what you get is a response that's way out of context to how serious the injury actually is. In my opinion, in my thinking about this problem, there's a real injury, whether it's like a nerve irritation, a muscle spasm, and the injury is in an awkward place. So it's going to be painful and annoying, but not to the level where that it takes us to with our just, it's so difficult, and it's just so hard to reduce pain and tension, and just doesn't seem to want to budge. And that's way out of context to how serious the injury is itself. We know in CPPS, these injuries are not life-threatening, but you've got a signal coming from a very crowded area in a part of the body that we don't need to think about generally. When everything goes right in pelvic floor, it's not something you need to think about. So when something goes wrong, your brain does a very, very poor job of handling the signals coming from the pelvic floor. And there are actually a number of studies that have come out over the past 15 years or so that show that CPPS sufferers have changes in their brains, the emotional processing areas in their brains. So it's not that people with pelvic pain are high strung or are find problems in everything or just can't deal with, a problem like this. It's that it really negatively affects your brain and changes your brain. And so I want to talk a little bit about some of these studies that demonstrate this. So in 2012, there's a study that came out of Switzerland, which used MRI brain scans and concluded that, quote, in patients with chronic pelvic pain syndrome, compared to healthy controls, there was a significant reduction in relative gray matter volume in the anterior cingulate cortex of the dominant hemisphere. This article also describes the anterior cingulate cortex as a core structure of emotional pain processing. There's another study from 2016 coming out of research from Stanford, Northwestern, and USC. In the abstract from that study, it says, we present the first evidence of regional white matter abnormalities in men and women with UCPPS compared to positive irritable bowel syndrome, IBS, and healthy controls. There's a third study that came out of China in 2022. It states in the abstract that the results demonstrate that the insula, anterior cingulate gyrus, postcentral gyrus, and precuneus are significantly associated with CPPS patients' pain feelings and cause dysregulation of painful emotions, lowering patients' tolerance to stimulus. I have links to these studies listed in the description if you're interested in looking that up. So this is why pelvic pain is so difficult to deal with emotionally. It's because it affects parts of your brain that deal with emotional regulation. And so these changes to the brain cause this emotional dysregulation, and getting out of this dysregulation is very difficult. Unlearning these emotional responses and fixing this dysregulation is how I was able to create an environment in my brain and my body that allowed for small reductions in pain and tension that over time built up to the point where I was out of pain. So this leads me to the title of this video, How I Beat Pelvic Pain Using Emotional Detachment Therapy. Now, I didn't come up with this term to sound fancy. I just think it's an accurate description of what I did to get over this problem. So I'm going to just talk a little bit about what the principles of this are and how I think this works. Or maybe I'm just going to define exactly what I mean by this phrase, emotional detachment therapy. So first, by using active meditation to focus only on the physical space of the pelvic floor, we both improve our brain's relationship with the pelvic floor, we make it more familiar and less scary, and create a distraction from the pain and emotional dysregulation inherent in pelvic floor pain. 2, by taking note of any emotional interruptions during this process and treating them as trash or perhaps as a faulty brain response, we start teaching the brain to stop these emotional reactions, which are so connected to our pain experience. Essentially, we detach these emotions from the source of the pain, which is the pelvic floor. By practicing this meditation, our sense of the space of the pelvic floor improves, and our brain gets better at moderating its emotional response to the pain sensation. This helps the brain to learn that the injury is not that dangerous, and therefore danger signals are turned down, and both the brain and pelvic floor become less sensitized and less overcharged. Number 4, this leads to an improved healing environment for the pelvic floor, even if at first it's only for 5, 10, 15 minutes at a time. This healing environment allows for small but incremental improvements that eventually lead to significant pain reduction. So we know that pelvic pain causes these issues in our brain, and that the way it affects our brain creates this emotional dysregulation, which makes this problem so hard to get out of. But what else is it about the pelvic floor that makes this problem so difficult? Well, I think it has to do with, again, faulty signaling between the pelvic floor and the brain, and also our brain's sense of the area, how our brain maps that area. But before I dive into that, if at this point you're curious if I have a course dealing with this subject, yes, I do. It's called Brain Retraining for Pelvic Pain using Emotional Detachment Therapy. It costs $59. The link to it is in the description below. It's about an hour and a half of content. The first 45 minutes of content deal with how to actually go about doing this type of meditation. Now, when I started to get some results meditating in this way, I started to make these little pencil drawings, which were like a representation of this visualization, remapping, whatever we're going to call it right now. I just started to make drawings, and I wasn't sure why I was doing it at that point. This was some years ago. I started to do these pencil drawings of the pelvic floor, of what I would be imagining, visualizing as I was doing this meditation. From these pencil drawings, I developed a series of 8 graphics and an animation, and I use these in part 1 of the course as a way to get you oriented to thinking visually about the pelvic floor and not emotionally about it. So I use these graphics, which you can see here. I'm showing some of them here. They're labeled. I use them as prompts, and I basically walk you through the process of meditating in this way and how to get very sensitive to emotional interruptions that you might face, what to do when it doesn't seem to work right away, just how to approach the problem and what to think about as you're starting to meditate in this way. That part of the course is roughly 45 minutes long. There's a part 2 to the course, which is the exercise and stretching part of the course. I do think that exercise and stretching is important when it comes to bringing down your pelvic pain symptoms, but I treat it in a completely different way. Everything that I did and that I think makes sense and that is included in this course as far as the exercises is in service of the emotional recovery. What do I mean by that? What I mean is if you have a posture that's hunched, if you have tension in your abdominals, if you have tension in your hamstrings, and you have things that are keeping you kind of constricted and hunched in this manner, that's going to trigger these emotional responses. It's not going to help to create this healing environment. So all of the exercises are meant to help create a more relaxed posture, I guess you could say, between sort of your rib cage and your knees. So there's a lot of hamstring exercises. We deal with the abdominals, some stretches to open up the back. All of these things are meant to help you uncurl yourself, walk a bit straighter, keep your abdominals relaxed. It's these things that help this emotional recovery work better. And in the exercise part of the program, depending on like what exercises, I actually will use the meditation along with the exercises. So certain stretches, it's like we're going to do a stretch. Now we're going to visualize where the pelvic floor is in space. We're going to find any pain point. We're going to go back behind that pain point. And so I work in some of this meditation into these exercises. That part of the course is also about 45 minutes long. I just go through my routine. You can watch and just go along with it and do the exercises along with me. And you don't have to do it exactly like I'm doing it. Everyone's different. Some people may, if you have back issues, maybe some of the exercises you might want to modify. And, I guess I would say consult your healthcare practitioner if you have concerns about some of the stretches, although they're not very intense, really. They're more meant to target areas where tension can be held and can tend to trigger or keep our core and our gut and this whole area too sensitized. For example, I have some tension in my hamstrings. It's always been a problem. So dealing with that helps me to walk in a little bit more of a relaxed manner and stand a little bit better, carry myself a little bit better. This helps to create a more calm environment where the amount of emotional dysregulation is not amped up. It's not pushed. It helps it to stay calm and to become less and less. Anything we can do to keep upright and calm and tension-free between our ribs and our knees is going to only help us with this emotional recovery. So that's what the exercise program is about. the exercise part of the program is about. I also have a part 3 to the program. It's just a short video where it's like additional tips and tricks. I talk about supplements. I talk about what I think about physical therapy, if I recommend it, just sort of like questions I've gotten on various forums over the years where people have just, asked me, and it's just way more than I can kind of answer. So I'm going to do it in this video as far as, especially at the beginning, if you're at the beginning of this problem and you really are overwhelmed, like when this first hit me, I had no idea what to do. It was just a lot of panic. I talk about some of these things that you can do at the beginning, which may or may not be useful. It's really not the main part of the course. The main focus is on how to think of the pelvic floor visually and how to meditate in a way which is going to decrease and help fix this emotional dysregulation. It's really much more of a brain therapy, brain recovery approach to this problem, which I think is really missing as far as everything I've read about the problem or seen any provider I've gone to. It just seems to be a missing part of the puzzle. Everything seems to be either you're going to stretch your way out of this problem, but then when it comes to the anxiety, it's just, well, distract yourself, find something that you like to do. Well, I think I have a more organized way to help your brain recover, at least for me. And let me just take this further here. I don't know that this will work for you. And I don't understand any program that has to do with pelvic pain that can make any kind of claims saying things like, in a year, X amount of time, you're going to be better. You can do this in 6 months. You can do it in a year. I don't know if this will work at all. It worked for me. I think it makes sense. I think there's a solid reasoning behind why it may be a key for you. But I don't make any claims that it will work. I think we all come to pelvic pain for different reasons and with different symptoms and, different issues have sort of caused this. I had back surgery and hernia surgery prior to having acute onset of this problem. I also had surgeries in the pelvic region when I was a kid. So I've been dealing with similar issues. When I was a kid, it was not the same kinds of issues. But I've been struggling with related issues for many, many years. And acutely, it was really 4 years in my early 40s. That's all to say that, yes, this may be a key for you, but I'm not going to be on here claiming that it will work in some preset amount of time. If I'd had this when I first started, I think I would have gotten better quicker. But that's me. If you're someone who feels like anxiety is a major issue for you with this problem and you're looking for a more organized way to deal with that anxiety, this course may really be useful to you. But even if outside of this course, if you are able to take any information in this video and apply it to your own situation in a way that's beneficial, I think that's great. I want to talk a little bit more about why I think we have such a difficult time overcoming pelvic floor pain and why our brains have such a hard time dealing with pain signals from that area. In your brain, there's a sensory strip located in the parietal lobe, and it maps certain parts of your body. It's called known as the sensory homunculus. And what that means in Latin is little man. So in essence, you have a map of your body that lives in your brain. It tells you where the parts of your body are, and it's responsible for processing sensation coming from these parts of your body. So, for example, if you close your eyes, you know where your elbow is, and you know where your shoulder is without having to look because you've got a map of your body in your brain. Sometimes you've heard of phantom limb pain, where people who lose a limb will still feel pain in that missing part of their body. It's because they still have a map of that part of their body in the brain. So this map originates from the 1930s, where there were experiments done on people that were going to have brain surgery for epilepsy or for a brain tumor. And before they had the operation, while they were awake, there were these experiments done where parts of this sensory strip were stimulated, and it corresponded to the patients would respond with where they felt sensation in their body. It was like very in-depth research done. And from this came this concept of sensory homunculus, where certain parts of the sensory strip correspond to sensory processing for certain parts of the body. So if you look at a picture of this, you see it's like a distorted image, and that certain parts of the body are represented in larger detail than others. For example, like the lips, hands, mouth, things that we use all the time take up more space on this sensory strip. But one curious thing to notice about this is that when these experiments were originally done, they placed the pelvic area, or the genitalia, somewhere near the feet as far as where the processing for pelvic area exists on this sensory strip. The rest of the sensory strip, the rest of the parts of the body flow in this sort of more of a linear fashion from top to bottom. But the genitalia, for some reason, which is in dispute, and there's been new ideas about this stemming from the 90s, and there's been some other research done. But for 60 years or so, it was this map of this image of the sensory homunculus placed the sensory processing for that part of the body near the feet. So it's a small part of the brain that processes sensation coming from that part of the body. We're not sure exactly where it is in the sensory strip, and it's not much space as compared to, nose, lips, or mouth. Now, there have been studies done on, for example, pianists who, when they develop a certain skill, the part of the brain devoted to processing for the hands gets bigger. Now, I can't sit here and make claims that, because the area for processing sensation coming from the pelvic floor is in a weird spot, or it's not very much space devoted to processing sensation from that area, I can't make concrete claims about that. But what I can say is the sensation, the pain that we deal with when we have pelvic floor pain is hard to describe. It's difficult to locate. You kind of know where it is, but it moves around. It changes shape. It's a distorted, disturbing sensation unlike anything else. Having gone through, back surgery and just other sciatica, whatever, those are more understandable. It's like your brain, it hurts. Your brain can deal with it. This one, it's a pelvic pain. Your brain has it does not deal with it well. And besides the fact that the pelvic floor is located in such an awkward place, like we talked about, maybe it's also the case that your brain just has a bad map of that part of your body. So when you get an injury to that part of your body, not only is it in a crowded area, but your brain doesn't have a good sense of where it's really coming from. And so this maybe is why we get this distorted pain signal that's so hard to deal with. So maybe that's why this visualization and getting more familiar with the space of the pelvic floor helps improve your brain's sense of the space of that area. And when your brain becomes more familiar with it, the danger signals are turned down. The nerve cells aren't so sensitized. The danger signals get turned down. The emotional dysregulation starts to get better. And you begin to create this healing environment in the brain and body where you can start to build pain reduction. And over time, your pain should get less and less. In this way of thinking, again, I don't make any claims that this will work. This is my theory of pelvic pain. This is how I got out of the problem and beat this problem. This is a problem I've had for a long time. Most of my life, I've had symptoms, not necessarily always acute, really 4 years of just acute problems, but related issues. I talk a little bit about in the course. I don't want to get too into like my past as far as the whole medical history or whatever, and I don't get too into it in the course. I just briefly talk about it, but it's been a problem for a long time, and I've wanted to put this information out there for a long time. And so I'm glad that I'm able to do that now. I hope that this has been useful for you and that you've gained something from this. Again, if you think this course may be a key for you, the link is in the description below. If not, I hope you got something out of it. I want to wish everyone the best of luck in their healing journey, and thanks for watching.